Hey everyone, today I'm going to be discussing my history with medical discrimination and the story of how I got on hormones. For me, I don't think it's really possible to separate these two stories without sacrificing the quality of either of them, so I'm going to tell them together. It's a topic I've been wanting to do for a really long time now, but I think it's just a really hard video to do because it is so personal and it's affected me so much, because it's been such a long time and it's really hard to be exhaustive about every single detail and experience I've gone through, and because many of the issues that I'm expressing in this video I'm still going through. So it's not going to be the be all end all of my experience with medical discrimination. So I'm going to tell the story as best as I can, but there's going to be inevitable details left out. Anyway, so my story of pursuing medical transition begins about 2.5 years ago, while I had been out as trans for much longer. It had taken me a long time to gather up the guts to actually pursue medical transition. It was the start of my second year of university when I had finally overcome my fear enough to at least apply for an appointment. I had ended up getting in with both a doctor and a counselor, and my appointment with the doctor went absolutely horrible. When I had arrived at the appointment, she had made me restate the request for the appointment in person, and immediately after I had told her that I was looking to transition, she had shot me down. She stated that I would need to present as a woman for a year before I could be considered for hormone therapy, and that no doctor would ever take me seriously. I was just wearing a basic woman's t-shirt and jeans, and it's even a lot more feminine than I present now. There also was no rule about needing to present as a woman for a year before you can be considered for hormones. And even if there was, I had already been out for over a year. Under my report, she had ended up writing that she declined me because I already had a doctor, which I didn't. My counselor was supposed to be specialized in trans patients, and while things started off well, she eventually would get hostile when I brought up my frustration with the other doctor, and she'd immediately deny my experience and just quote the doctor's report. She also adopted a weird system of gauging my dysphoria like it was depression, assuming that me talking about my trauma in therapy would cure me of my dysphoria and make me no longer trans. I continued seeing her for a while before realizing how harmful she was and that she wasn't productive at all towards my transition. The next appointment I made was with a family doctor that a friend had recommended to me, and I had continued trying to see family doctors, largely because I was told that I couldn't refer myself to an endocrinologist. There were a lot of clear red flags in the initial appointment. The doctor had walked into the room talking to me and had said something along the lines of transition being serious because you're not just a gay man. This was followed by a full interrogation of my life, all my trauma, sexual history, all the sexual violence that's happened to me, my childhood, my parents, how I was raised, and everything in the most invasive detail. And when I didn't want to discuss something, I was forced into discussing it in more detail. When I had mentioned My partner that I had at the time, he had been very insistent that they must be very, very confused and that they must be combating with their gender as well. I was persistently misgendered as well as any reference to another trans woman. It was bad enough that at one point he had even reversed my pronouns on file so that reception would call me by male pronouns. Around the same time, I had been getting some inflammation in the lymph nodes in my neck, just on here, on either side. And after some blood tests, it had also came out that I had an extremely low lymphocyte count. After various testing for a dozen different conditions, they weren't able to find any sort of illness or any reason that I would have lymphocytes low or that my lymph nodes would be swollen. So my family doctor had ended up diagnosing me with cancer. My lymph nodes continued to swell for a long time, and they eventually reached below my chin, and it was definitely very concerning. I underwent a large number of scans and processes, but the only way to discernibly test for cancer and know for certain was to remove an entire lymph node from my neck. Due to the complications of removing a full lymph node and undergoing intense surgery without any form of anesthesia, I hadn't yet at that point opted for any form of surgery to extract the suspected tumors. After a few months of all these screenings and scans and this whole process, I still hadn't heard back on any sort of feedback on what was happening with my referral to an endocrinologist who could handle HRT. I basically got the response of, "Oh, I didn't think you were serious." And he had told me that he was going to look for another doctor to take over for me because he knew this newer doctor who was interested in learning about trans patients. The following appointment I had with him, he had said that he was not going to see me anymore and that he was going to cancel the screenings that I had scheduled. Luckily, my hospital has provisions, so doctors can't just cancel a cancer screening for an active cancer patient. So the hospital had ended up calling me and said that they found a concerning action on my report and wanted to check in to make sure that I still wanted to undergo my cancer screenings. But regardless of that, I had lost the main doctor behind my cancer diagnosis and the treatment and all of that. The new doctor I was referred to was not at all what I was told. My appointment with the next doctor lasted about 5 minutes and consisted of her telling me that she didn't know what the last doctor told me, but she doesn't want to deal with trans patients. And she said that she'd refer me to someone else and she'd give me a call back later. I think it was something like 4 to 6 weeks before I had heard back from her. So I had attempted to refer myself to the same clinic, and luckily I was able to. I don't believe I ever did receive a call back from the original clinic. Eventually, after several months of waiting, I ended up getting in with an endocrinologist who specializes in trans patients. She has been quite a great doctor to me. She was able to take over the position of my family doctor and sort of take the lead on organizing my cancer screenings, and I very luckily did not end up having cancer. She eventually started me on HRT after we had been able to rule out my cancer diagnosis, but she wasn't able to take on from the position of a family doctor. So far, I've been referred back to the last doctor I was with, and then to a new doctor in the clinic, and then I abandoned efforts at that clinic, and I've been trying to go through my university to find a family doctor. Despite all my efforts, I still really haven't found one. The impact of all the medical discrimination I've experienced as a result of being trans has been quite immense. One evident issue has been that I haven't been able to get medicated for ADHD since I had started pursuing transition. There is a line of about 6 doctors in between the initial doctor that's prescribed me with ADHD medication, so it makes tracing the medical history for a new doctor nearly impossible. On top of that, I have a very hard time being taken seriously and being diagnosed as a transgender woman. The first doctor I saw regarding getting back on my medication had immediately asked me if I had a history of sexual trauma, and in response to me saying yes, basically assumed that couldn't mean I have ADHD if I've got sexual trauma, and that I'm likely conflating the two, and she refused to see me regarding my ADHD diagnoses. Subsequent appointments I've had regarding trying to get back onto my ADHD medication have pretty much all gone the same, just to lesser extents. The doctors largely argue that me having trauma means that my symptoms are conflated and that I cannot have ADHD, despite being already diagnosed and having a large amount of psychological factors and childhood symptoms of ADHD that are fairly distinct and not conflatable with anxiety or trauma. My status as a trans woman has also made it nearly impossible to receive basic care. I've got respiratory issues that are sourced from my nasal cavities, and it's a relatively easy surgical fix to correct. But it's a surgery you can only get after 18, and then my ability to request it had been delayed several years by not having a family doctor. And now that I've finally been able to be referred for surgical correction, there's only one surgeon in the city who serves trans patients. So even though it's a universal surgery for just nasal reconstruction and has nothing to do with my transgender status, it's highly recommended that the only person I'm able to pursue is the one surgeon that treats trans patients. This also forces me to go down the private route, which is a lot more convoluted for insurance purposes. And because it's only one doctor in the city, I've been waiting about a year now and haven't even heard back about a potential assessment. Because I was trans and refused to be seen by my family doctor regarding a cancer diagnosis, it had effectively delayed my treatment by a year. And had I ended up actually having a positive case of cancer, that would have very, very likely resulted in my death. Often telling these stories to other people, I'm only confronted with being blamed because I technically have the human right to not be refused treatment on basis of being trans. This entirely does not matter though when there is no infrastructure to report doctors who refuse treatment to you on basis of being trans. I mean, it's possible to sue over an issue like that, but myself and the average trans woman does not have the financial resources to sue a doctor or a clinic. This is amplified by the fact that I had an active cancer diagnosis that I was unable to find a family doctor to treat me for. So it was of a much higher priority for me to be able to cure my cancer than to potentially win a lawsuit. Human rights violations are also impossible to prove. There would be no evidence on my behalf for him refusing care to me on the basis of me being trans beyond my own word. And legal courts are certainly not going to be biased in favor of a low-income trans woman, especially in my province. But nonetheless, because I, on paper, have human rights that should protect me from it, other people aren't able to empathize with it or even believe me when I tell them. And I am often blamed for not reporting him. I've also had a lot of issues that are entirely systematic for my province's healthcare. Still to this day, my dead name is always the first thing put on display. Nurses often print off the wrong papers that have my dead name on it, and it entirely delays the process and also subjects me to continued uncomfortable encounters and discrimination. My trust in the medical system is also entirely eroded. There's no guarantee that I will be treated fairly under the medical system or get basic care, no matter how serious my condition is, because I've had a history of doctors working against my own healthcare instead of for it. I think conversations like this are really important to have, especially because cases of serious discrimination of transgender people are really often overlooked. The acceptable range of discussion of trans rights in the media has often been narrowed down to trans people getting misgendered and trans people not being allowed to go into the washrooms. But in my opinion, there are a lot more serious issues than that need attention. Trans people are at a very high risk for premature death. And despite what most discussions allow, this largely isn't personal murders. This is because trans women are on average paid a third of the average person. A large amount of trans people live in poverty, and the experience of being so highly marginalized and discriminated against puts us at extreme risk for a lot of health conditions. This is only met with widespread medical discrimination, where trans people aren't taken seriously and often refused healthcare. I believe that these are issues that need a core focus within trans media depictions. I really hope you enjoyed this video and that you found it informative or helpful to you. If you did, I would love to have you follow along, and I would love to hear your thoughts and experiences in the comments. Stay safe. I hope you have a great day, and I will talk to you later.